group. Some few housekeeping rules. You can choose the language that you would like to listen to the press conference by turning on the globe icon at the bottom right of your screen and selecting your preferred language. Yasmina, could you kindly explain that in French?
Oui, bonjour à tous et bienvenue à cette conférence de presse de l'OMS. Si vous avez des questions, merci de bien vouloir utiliser la fonction Q&A qui est située en bas de l'écran et merci de bien vouloir indiquer votre nom ainsi que le média que vous représentez. Et si vous souhaitez écouter la conférence en français, vous pouvez cliquer sur l'icône en forme de globe située à droite de l'écran. Merci beaucoup.
Thank you, Yasmina. Joining us from Brazzaville is Dr. Matshidiso Moeti, the WHO Regional Director for Africa. And I will now let Dr. Moeti introduce our other panelists and give a brief opening remarks. Dr. Moeti,
thank you very much. Thank you very much, Collins, and good morning and good afternoon, bonjour, bon dia, and welcome to all the journalists joining this end of the year briefing for 2021. I'm really pleased and excited to be joined today by Professor Flavia Senkubuge, the Associate Professor of Public Health at the University of Pretoria, also President of the Colleges of Medicine of South Africa, and the Chair of the African Advisory Council on Research and Development. She will share her perspectives on emerging pandemic trends in Africa and the outlook for 2022. A very warm welcome, Prof. Flavia. There have now been nearly 9 million cases of COVID-19 and nearly 225,000 reported lives lost in Africa due to the pandemic. Africa is now officially in the fourth wave of the pandemic, which is partly due to the Omicron variant. There's been an 83% surge in new cases on the continent this week compared to the previous week. This is the fastest surge recorded since May last year. We are cautiously optimistic, though, as we are seeing fewer deaths during the early weeks of this current wave when compared to previous surges. Just over 3,000 deaths have been reported during the first 3 weeks of the fourth wave, and that's about half the number reported in the same period during the third wave. Additionally, evidence from South Africa is that while hospitalizations have increased by almost 70% in the past 7 days, intensive care unit bed occupancy rates remain low at 7.5%. Just 14% of hospitalized patients are reported to have needed supplemental oxygen, and deaths have remained low, with only 11 reported yesterday for the previous 24 hours. So mild illness mainly linked to the Omicron variant. However, with the number of new cases hitting record highs as rates double every 5 days, we can't afford to drop our guard. We're entering the year-end holiday season of traditional gatherings and travel, with vaccine coverage still disappointingly low in Africa. As things stand, predictions are that if things continue like this, Africa may not reach the 70% vaccination coverage target until August 2024. Just 6 countries have hit the year-end target of fully vaccinating 40% of their citizens, with only 20 managing to achieve a 10% coverage. I cannot stress strongly enough that vaccination is our best defense against the COVID-19 pandemic. We're at a pivotal moment, and complacency is our enemy. Africa is seeing more consistent delivery of vaccine doses, and we can still save many lives if we urgently accelerate the pace of vaccination. In real terms, if African countries get the doses and support necessary to vaccinate 70% of their populations, as is the case for many wealthy countries, we could avert tens of thousands of deaths from COVID-19 in 2021. I'd like to stress that these are not just numbers. They reflect the loss of mothers, fathers, sisters, brothers, children, colleagues, and neighbors whose deaths cause untold suffering for those they leave behind. And importantly, Africa's vaccine challenges are being compounded by Omicron-related travel bans. There is no strong scientific evidence to support the introduction of such restrictions to curb the spread of the virus. Yet they have devastating economic repercussions for the affected countries, which are struggling to reboot after 2 years of pandemic-induced negative impacts. Travel bans can lead to less money for food, medicine, education, and a host of services that keep people healthy, consequently jeopardizing the welfare of millions of Africans. They can also affect the supplies of critical items for health and other development areas. Globally, there are now more than 22,700 cases of Omicron reported in 59 countries, including 11 countries in Africa, which account for about 1/3 of the cases. However, Africa's share is steadily dropping, and South Africa can no longer lead the world in Omicron cases. As such, I'd like to appeal to countries to urgently reconsider the recently introduced travel bans. This is a time to instead show solidarity with your neighbors and to act in the interests of the global good. Going forward into 2022, WHO's COVID-19 strategy continues to focus on boosting vaccine coverage. It will also concentrate on increasing surveillance to up case detection and to track new variants of concern. Of course, the public health measures of prevention, wearing masks, physical distancing, and hygiene are also vitally important. There's a lot more hard work ahead before we can bring this pandemic under control in Africa and the world. I'd like to take this opportunity to acknowledge the tremendous efforts of WHO colleagues, our global and regional partners, African leaders and governments, ministries of health, our health workforce, and local communities. I'd also like to thank members of the media. You've worked so hard along us in 2021, helping to disseminate accurate information to your audiences around the world. So welcome again to this press conference, and I look forward very much to today's discussions.
Thank you, Dr. Moeti. Professor Flavia Sebungobe, please, could you tell us about the trends of COVID-19 in South Africa and the outlook for 2022, particularly with regards to Omicron?
Thank you very much, Collins. And I do first want to greet Dr. Moeti and also all the colleagues who are at this webinar, and just to also say all protocol observed. In terms of the trends in South Africa, of course, COVID-19 was introduced in South Africa in the early 2020, and we had our peak of cases during the week of the 5th to the 11th of July. Of course, to date, as Dr. Moeti has just said, we have 13,992 cases, which takes us cumulatively to over 3 million cases. And we have 174,340 active new cases. And the positivity rate, which is the number of tests done that have a positive result, are at 31%. And of course, as Dr. Moeti said, we have, as of 13 December, 11 new deaths, which take us to a cumulative total count of deaths of 90,148. I must stress and say that many of the new cases are in our province of Gauteng, followed by KwaZulu-Natal. And what is interesting, colleagues, is the seroprevalence, which I do want to chat about, which is the prevalence of individuals in a population who have antibodies to an infectious agent. After our second wave, 60% we had 60% seroprevalence, and this data came from our National Blood Service together with other studies. And our modeling colleagues estimate that we had 70% seroprevalence after the third wave, and an unpublished study, which is going to be published in the coming weeks, that has been done in the Gauteng province, estimates the seroprevalence to be about 80% in adults after the third wave. I do have to mention also, in terms of the vaccination coverage, as of 13 December, 40% of South Africans have received their vaccination dose and 25% are fully vaccinated. We are battling in terms of whether you call it hesitancy or indifference, but there is a concern in terms of the uptake of the vaccine. And so in essence, when we come to the findings on Omicron, if we take the 4 epidemiological periods from 13 November to 4th of December, we had an exponential rise in COVID-19 cases, and we certainly are in the 4th wave. And for instance, from the 1st of December, I can say that this is when the indication was that we entered the fourth wave, and we've again had a week on week increase in the number of cases, which have been higher than before. And as I said, the test positivity rate within these 4 periods started from 1.4% all the way up to 31%. And if you look at the Gauteng data, it's actually even higher than 31 to 33.9%. And as Dr. Moeti said, we've seen some interesting trends in terms of hospitalization and excess deaths, which have not been so high. And also we have seen that we have severe or less severe illnesses. And among those who are admitted in our hospitals, they have a lower requirement of oxygen, lower ventilation, and we certainly are not seeing this high number of ICU or high care, which really just shows us in these early indications that indeed the illness may be less severe. Early on in the 4th wave, we did see, especially among the children who are less than 5 years, having an increase in terms of admission. But now, currently, we are seeing the trend turning towards adults. And so all our admissions are mostly in unvaccinated individuals. And again, a case in point, as Dr. Moeti was saying, for vaccine access and solidarity across the globe to ensure that the Africa region does get access to vaccines. I must also add that in terms of the admissions have a shorter duration, or what we would call length of stay, because previously we, on average, the admission or length of stay was averaging about 9 days. But right now, in children, it's about 3 to 4 days. And in adults, it's between 4 to 5 days. And again, an indication of perhaps less severe disease. And this could be perhaps prior immunity from a natural infection, as I talked about the seroprevalence, and perhaps even vaccination, or maybe even lower virulence, maybe from the Omicron variant. But again, these are very early studies, and it's really postulation of what could be happening. And in terms of the COVID-19 outlook, Collins, for 2022, I think the first one has got to be global solidarity for vaccine access. I think, just in terms of echoing Dr. Moeti's words, we will never get out of this if we don't work together as one world. And I think what we have seen in the previous weeks of travel bans and isolation is something that I think will be very difficult going forward. And so I think global solidarity, particularly for vaccine access, is very important. One of the other things, of course, for Africa region is about strengthening the community-based case management in terms of developing as well clinical guidelines for the treatment of COVID-19, particularly in primary healthcare settings, because we have seen, particularly in our previous waves, that infections and deaths are happening very much at the primary healthcare setting. As the chair of the African Advisory Council on Research and Development, I cannot stress the support of the work of our scientists. I mean, we have seen exceptional work coming out from South African scientists, but there are a number of scientists across the region who've done exceptional work. And I think that the support of the surveillance work and many other research work that's been done to combat COVID-19 from the Africa region needs to be supported, and our scientists certainly need to be supported. And lastly, I want to again echo the issues around non-pharmaceutical interventions, which still remain important: physical distance, avoiding gatherings, making sure people wear masks, and ensuring good hand hygiene. And because I am on this platform and Dr. Moeti will not be able to say this about herself, I do want to commend the effort and work of Dr. Moeti together with the colleagues in WHO Afro, who have supported all our countries in ensuring that we work together. And I do want to echo the support and the thanks in terms of the media and all other stakeholders, the scientists, the frontline workers, the community workers, and each and every single person, including the grandmother in the village who may not be known by anybody, who's taking care of the family and ensuring that they are safe during this period. Thank you. Back to you, Colin.
Thank you, Professor Flavia Senkubuge. Now that we have heard from all our panelists, it's your turn to ask your questions. To do this, use the Q&A function on your Zoom application. Please remember to provide your name and the name also of the news outlet that you represent. Just to let you know, we also have on hand Dr. Fiona Atuhebwe, who is the new Vaccine Introduction Officer of WHO. We have Dr. Tiano Balde, who is the Incident Manager for the COVID-19 Emergency Response in Africa, and also Dr. Nixie Humede Moelexi, who is the Regional Virologist. Now, we've got a question from CGTN, and this question goes to, I will invite Dr. Moeti and Dr. Fiona Atuhebwe to respond to that. The question goes is, we are seeing the new Omicron variant spread so fast in some parts of Europe, despite the majority of their population having been vaccinated. We know Africa has been behind on that front. To what degree is Africa being threatened by the new variant? I will invite Dr. Moeti and Fiona to respond to this question.
Yes, thank you for that question. As we said, we have 11 countries that have identified that the Omicron variant is present in these countries, including not only just in Southern Africa, it's been detected, for example, in Nigeria as well. And so, of course, we recognize that African countries are at risk of having the variant emerge, as has happened in European countries, and it is spreading in countries around the world. I think a couple of things. Of course, we initially saw, due to the work done by scientists in South Africa and Botswana and the immediate reporting that they did of the presence of the variant, this variant seemingly emerging in Southern Africa. There are questions about it having been detected in samples that were taken in some other countries in Europe earlier, and therefore the fundamental question, where is it emerging? I think we need to think that the entire world is vulnerable to the emergence of a new variant, but we need to put the risk in perspective, as has been expressed by Professor Flavia and myself, based on the evidence that we are seeing. At the end of the day, the reaction to the emergence of a new variant needs to be linked to what we are starting to observe in terms of the risk that it presents to lives, about overwhelming health systems in countries, and the disruptions that it will make in economies in countries. As Prof. Flavia said, the evidence is a bit early, but we are somewhat becoming reassured that this seems to be mainly causing mild illness. So indeed, Africa is vulnerable. Many people in Africa have not been vaccinated. The virus is spreading very fast, including in places where people have been vaccinated. It is causing relatively mild illness, particularly among those who are vaccinated.
Thank you, Dr. Moeti. Dr. Fiona Atuhebwe, would you like to weigh in on that?
Thank you very much, Collins. I think Dr. Moeti has said it all. But we also need to note that for Omicron, we have been testing more in certain populations that have higher rates of vaccination. For example, international travelers who most countries are requesting to be vaccinated, and these are being tested both before departure and in many countries on arrival. So if we test more vaccinated people will definitely turn out positive. But also studies are ongoing to see if the Omicron variant has an impact on the vaccine effectiveness. And it's important that we are patient. It will take another week or so before we have clear evidence on the vaccine's performance against the variant.
Thank you, Fiona. The second question from CGTN is that we are approaching the end of 2021, and as a continent, we have vaccination targets. How many countries have met them, and what are the projections for this year? What are the projections? The question goes to Dr. Moeti and also Fiona.
Yes, I will pass that question over to Fiona. I mean, clearly we had, as WHO proposed to countries, and they accepted, having covered 40% of their populations now with the second dose. So having sort of completely protected with 2 doses where it's necessary, 40% of their populations. I believe only 10 or so countries have managed to reach that target in Africa. So we clearly have a lot of work to do, both on ensuring vaccine availability, that solidarity that we talked about. And let me stress solidarity, not only in terms of those donations, but also in freeing up doses that countries have secured for the African Union and African countries to purchase. So I think we need to be very clear that we're not just asking for charity and donations, which is very welcome, but also freeing up the supply so that countries who have worked very hard to put together the resources can purchase these doses. We're concerned that there are some countries where not even 5% of the population has been completely covered. I think, again, that's about 10 countries, and then other countries are somewhere in the middle. So I'll ask Fiona to provide some of the detail there. We certainly have not done as well as had been the intention initially.
Thank you, Dr. Moeti, and that is very true. We thought would also be where the rest of the world is. But 20 African countries have reached the 10% target that was set for September. And these are Algeria, Botswana, Cabo Verde, Comoros, Equatorial Guinea, Eswatini, Lesotho, Mauritania, Mauritius, Morocco, Rwanda, Sao Tome and Principe, Seychelles, South Africa, Tunisia, and Zimbabwe. Namibia also reached this target at the beginning of November. Egypt, Mozambique, and Liberia too reached this milestone during November. 6 countries have also reached the 40% target already, which is quite encouraging. But again, we know, like Dr. Moeti has mentioned, we are still far. These are just 6 countries out of the 53 vaccinating African countries. And these are Botswana, Cabo Verde, Mauritius, Morocco, Seychelles, and Tunisia. From the WHO Afro projections, and based on the current vaccine supply and uptake, we have seen that Africa, it is projected that Africa may reach the WHO global target of 40% by early May 2021. And we know that by June 2021, we expect to have vaccinated 70%, but Africa will most likely be at 40% by then. 2 countries have already reached the 70% target. Those are Mauritius and Seychelles, the small island states. But also from the WHO projections, for Africa to reach the global target at the current rate we are going, the 70%, this may be late August 2024. So 10 of the 53 vaccinating countries have fully vaccinated less than 2% of their populations. And so as Dr. Moeti was mentioning, we still have a very long way to go as a continent.
Thank you, Fiona. Dr. Moeti, please, would you like to weigh in on this?
Yes, I mean, first, I think some of the targets that Fiona was talking about are for 2022, not 2021. I just want to correct that. And then just on the issue of the projection, if we carry on at the current rate, to emphasize very strongly that there is no intention whatsoever of continuing at the current rate. We are seeing vaccine supplies start to be more and more available in countries. And as I said, the African Union, through its platform for procurement, and also the COVAX, the multilateral platform that's been established by WHO, Gavi, other multilateral partners, are seeking to accelerate the availability of vaccines. There is a lot of work going on to look at previous experience in delivery and really make sure that we work with countries on their micro-planning, on making sure that the funding is available for decentralizing the operations so that we operate, having learned from what is happening currently, at a speed, intensity, decentralized that is very different. And really, to be very clear, the ambition is to not be still vaccinating up to 70% by 2024. So the intention is to speed up next year. And I'm very glad that this is an intention that's shared by the governments, by the African Union, by WHO and the partners, and we're absolutely on the task of making sure that this speeding up happens. It will require effort on the part of our governments and global collaboration and solidarity.
Thank you, Dr. Moeti. This question is for Professor Flavia Senkubuge. Could you please tell us the rapid surge of newly reported cases in South Africa? How many Omicron patients in South Africa hospitals are seriously sick and are in ICU?
Thanks, Collins. As I said, we have data at the moment that I presented in terms of the patients' admissions that we have in South Africa. And so in terms of, maybe I can just go to, just to repeat what I said in terms of the patient admissions that we have in South Africa at this point in time, that we have Gauteng province. As I said, most of the new cases were in Gauteng, which were 6,711, followed by KwaZulu-Natal. And so we at the moment have about, in terms of the new cases that have been admitted, about 500 odd, and cumulatively 6,000 who have been admitted. But certainly in ICU, we don't have that many patients who have been admitted. Thanks.
Thank you, Professor Flavia. We have a question from Sho Beppu from the NHK in Japan. Sho, could you please ask your question?
Yes, hi, thank you very much. Do you hear me?
Yes, we can.
Yes, thank you for the opportunity. I'm Sho Beppu from NHK, Japan's public broadcaster. My question is targeted to Dr. Moeti, if I may. Talking about the vaccine disparity, which we understand that is a tremendous problem. On the other hand, we do hear stories about the precious vaccines that have been unfortunately wasted or have not been administered in some countries. How regrettable is this problem? And do you have any figures about the scale of this wasting of vaccinations? The second question is about the challenge of vaccine hesitancy. During the interviews that we conduct with the public here in some African countries, we do hear many stories about very big, tremendous misconception of vaccines. And we do hear people citing reasons that are quite difficult to digest about why they don't take the vaccines. So what should we do all together to fight against this kind of misconception? Thank you.
Thank you, Sho. I will invite Dr. Moeti to respond to this question, and Fiona can weigh in on that as well.
Yes. Okay. Thank you very much for those very important questions. So far, just to give some figures, we have had about 434 million doses received in Africa, about 264 million doses administered in Africa, about 61% of those that have been received, and 910,000 odd vaccines have expired in 20 countries. That represents less than 0.25% of the doses that have been received in Africa. And I think if we look and see how does that compare to other regions, we heard earlier on some months ago of doses that expired and being destroyed in other countries, in the United States, for example. So it's necessary to dispel the impression that even as we are expressing concern about access to vaccine supplies, there are millions of doses being wasted, expiring in Africa. That is not the case. The main challenge in African countries has been access to vaccine supplies. I mean, we can also talk about the complexity of the range of different vaccines that are available in African countries. Sometimes, because of the supply shortages, the challenges in terms of predictability, when a vaccine is being delivered, what type of vaccine, and the need then for countries to prepare to deal with a variety of vaccines that have differing requirements as far as such things as cold chain are concerned, the type of syringes that are needed are concerned. So it means planning for the operation of vaccine delivery has been extremely challenging for African countries. And there is a great deal of concern now about ensuring that the vaccines that are being delivered in African countries have an adequate shelf life to enable the delivery operations to be undertaken in such a way that we minimize the expiry of vaccines and what might be considered as the waste of vaccines. Certainly, there is vaccine hesitancy, vaccine denial among people in Africa, as there are in many parts of the world. I think we've seen really dramatic manifestations of some of this in some higher income countries, people demonstrating, some politically inclined groups really very strongly against vaccines. We know that there are people who are hesitant, who need better information, who need some reassurance, and who then will accept to be vaccinated. We also know that there are people who, for various reasons, for ideological reasons, are against being vaccinated. And there is a very strong group of people that are deliberately spreading misinformation about vaccines in terms of danger, risk, and whatever. And we are working on this as WHO with our partners. We have an infodemic response initiative where we're working with some of the media outlets, monitoring what information being exchanged on the social media and ensuring that we provide the correct information through our website and in the social media as well. It is indeed a very important area that needs consistent monitoring, listening, communication, and really communication at all levels, by ourselves and our partners, by the political leaders in countries, and very importantly, by people that people will trust, will listen, who will find a receptive ear if we are working at the community level with various groups, with opinion shapers in countries. It's something that really does merit a lot of effort indeed.
Thank you, Dr. Moeti. Dr. Fiona, would you like to add something to what Dr. Moeti has said?
Thank you, Collins. I think Dr. Moeti has mentioned most of it, but just to add that in December 2020, we launched, actually Dr. Moeti launched the Africa Epidemic Response Alliance, which is an alliance of several partners in Africa that came together to ensure that we deal with this infodemic on the continent. Both the alliance, we also have the Viral Facts Team African Network. So both this Africa Infodemic Response Alliance and the Viral Facts Africa work in close collaboration with a network of trusted public health institutions to quickly detect and react to the spread of this misleading information and rapidly disseminate factual content. So this is ongoing, and we do now appreciate that most of the information that people get is from social media, and we're also getting through to social media, but also these press conferences, issues like these press conferences are not happening by coincidence. It is because we want to put out the right information and through the media, because people believe in you to get the right information out there. Over to you, Collins.
Thank you, Fiona. The next question is from Larry Madowo from CNN. And Larry wants to know that this question will go to Dr. Nixie Moelesi. The question is, do you know how many people have died of the Omicron variant in Africa so far? And what percentage of global Omicron cases so far are in Africa? Dr. Nixie Moelesi, could you kindly respond to this question for us?
Thank you so much, Collins. As far as our knowledge is concerned, I don't think we've got any case that has been confirmed that a person has died because of Omicron. In terms of the recent global cases that have been reported, I think we've got about, as of today, we've got about more than 3,000 cases that has been reported globally. And as Dr. Moeti mentioned earlier on, that we are seeing also some of the international countries now that have been overtaken South Africa in terms of the number of cases. So in total, altogether, we've got about more than 1,000 of cases of Omicron that has been reported in Africa, of which 900 of those are coming from South Africa. So the rest of the countries, as you know, that it was mentioned earlier on that we've got about 11 countries that has reported the Omicron, starting from Botswana, Ghana, Malawi, Namibia, Nigeria, Senegal, South Africa, Tunisia, Zambia, and Zimbabwe and Uganda. And in addition to that, just to add to what Dr. Moeti has mentioned of those 11 countries, we've also got 2 additional countries that have just been saying that they might be seeing some sort of positive cases that are linked to Omicron. So those ones are Sierra Leone and Mauritius. So should those 2 countries also get confirmed and also become declared by their own government, then it means in total, as of today, we might be having about 13 countries that has reported the Omicron. So the data is as it stands as of this morning, Collins. Thank you so much.
Thank you, Dr. Nixie. I just want to ask a question to Professor Flavia. There's a question that from Dong, and he's asking from Frank Liu at the paper. He's asking that, have we seen the peak of the 4th wave in South Africa? If not, when will we expect to see that? When do we expect that?
Thank you very much, Collins. We're really not sure, right, whether we have seen the peak or not, but we do know that we've entered the 4th wave, as I said, from the 1st of December. If you look then at the statistics in terms of when, we enter peaks, these would usually, if you look at the modeling for the previous weeks, for the previous waves, you will see that it usually, give or take, the epidemiologists will talk about 90 days. And so in essence, I think it will all depend, but we do see that we certainly have entered the 4th wave. And as I said, I mean, if you look, for instance, at just the numbers in terms of percentages of what we have, in terms of admissions to the hospitals, as one of my colleagues asked previously, that during this period, cumulatively, if you look at the epidemiological period that I said of the 4 weeks, at the moment we have an intensive care of 5.6% compared to 9% the last time, and a lower proportion of these patients, require supplemental oxygen. At the moment, we have 19.4% of them who require supplemental oxygen, compared to 43.1 previously. And also it's an interesting statistic in terms of ventilation, that at the moment we only have 1.4% of those who have been admitted. And these statistics are coming from the Gauteng province because, of course, we don't have data for the whole country, that in terms of ventilation, we have 1.4%. compared to 8.2% previously. So it's really difficult to say, we do have the modeling there, but we certainly know that we are in the 4th wave.
Thank you so much. We have a question from Deborah Kolawole from the Punch newspapers in Nigeria. And I will invite Dr. Moeti and Dr. Balde to respond to this person. Now the question is, now that Africa is officially in the 4th wave, we have also started experiencing a rise in figures in Nigeria. With the incoming festive period, would limited restrictions be advised? Introductions of restrictions in gatherings, and also would community testing also be recommended? So this question goes to Dr. Moeti, and Dr. Balde can weigh in.
Yes. Thank you for that question. I mean, indeed, we have started to see a fourth wave. We call it the fourth wave in Africa, but we're not seeing all countries indicating an increase in cases. In fact, it's mainly been in Southern Africa, linked to the Omicron variant mainly, we think, and also we have on and off seen a few weeks ago, it was in Central Africa where the increase in cases. We're seeing now some increases in some countries in West Africa. It is a concern that these increases are happening before the people start moving, traveling for the festive season. So that means that we really need to be preparing in those places where we started in increases and seeing increases to make sure that these do not get out of control. Indeed, if it is necessary, it might be useful to impose local restrictions, particularly in terms of gatherings indoors, and ensure that some of this is driven by people themselves. People need to know that if you're going to gather, particularly if you are not vaccinated, then you stand at a higher risk of being infected. We also need to combine those measures that are imposed with encouragement, support for people to take the public health measures to themselves, protect themselves, because we know that these are effective measures. I think overall, we have seen very severe economic impact in Africa from the severe lockdowns that were imposed in the earlier stages of the pandemic. And we are advising very strongly on really local measures that are essential, support to the population to use the very effective public health measures. And indeed, wherever it's possible, it is a very good idea to do community-based testing, because then that helps us to track where the virus is circulating, the degree to which people might already have been exposed to the virus, and enables then the adjustment of the public health and other measures in order to contain the disease with a minimum of disruption on economic and other activities that are so essential in our countries.
Thank you, Dr. Moeti. Fiona, could you kindly weigh in on this?
Sorry, I wouldn't have much to add, Collins. I think Dr. Moeti has done justice to that. Probably Dr. Balde would have more to say.
Dr. Balde, would you like to weigh in on this?
Yeah, just a few additional elements. I think the new ones here is to mention that this is probably the fourth wave, and the region went through 3 different waves, so a lot of things have been also learned. And when we see the dynamic of the wave, which really started in Southern African countries and then moved to East Africa and then to West Africa, as the journalist mentioned, like currently in Nigeria, we are seeing currently a kind of upsurge of cases in those countries such as Nigeria, but also the other countries like Mali and Burkina Faso, linked or not linked really to the Omicron. But at the moment, so we are having the combination of these 2 elements. We have the Omicron, but also the upcoming festive season. So definitely all of these measures need to be taken and encourage colleagues, and populations to adapt, these public health and social measures. So from the WHO end of point of view here, this action about monitoring the situation in all of these different countries, I think this is one of the major elements, and obviously capacitating those countries to be more ready, to respond to any upsurge of cases. And obviously the component of the risk communication and community engagement is something which is very, very important, and the component also on the surveillance and to see wherever there are these upsurge of new cases, therefore, to roll out all of the different response measures. So I think these are some few elements that we might need also to take into consideration while going into the next year. Thank you, and back to you, Collins.
Thank you, Dr. Balde. The next question is from Le Monde in Paris. And I will invite Dr. Fiona Atuhebe to respond to this question. What can we say about the deliveries of vaccines to COVAX, both in terms of doses promised by rich countries and doses purchased by the COVAX facility itself? Did they witness any acceleration? That is, did they witness any boosting of their activities? And did the Omicron variant change the path of their deliveries? Over to you, Dr. Fiona.
Thanks again, Collins, and that's a very pertinent question. So as Dr. Moeti had mentioned before, the African continent has received more than 350 million doses of the COVID-19 vaccine, different types of vaccine doses. And we need to note that about 80% of these doses were all received in the last 4 months. So yes, indeed, after the US and Team Europe went out to donate vaccines to the African continent, we've seen an acceleration. Also, with more doses, vaccine types that were received emergency use listing, COVAX has also been able to purchase more doses. So this number indeed has seen an acceleration. And as it has been mentioned before, right now we do have a number of doses, actually lots of doses that can be used on the African continent, and that is why we are trying to ramp up the vaccination. And no, the rising of the Omicron variant has not changed this path. We know we still need to vaccinate, and we shall go on and vaccinate. These vaccines so far have been seen to still have a strong protection, even in the presence of the Omicron variant. So the path has not changed. We are still bringing in more doses onto the continent.
Thank you, Dr. Fiona. The next question goes to Dr. Tiano Baudet, and it's from the New York Times. The question is, much of the data on severity of illness has come out of countries like South Africa with higher vaccination rates than elsewhere on the continent. Do we have any data yet on the severity of illness in countries with lower vaccination rates? Over to you, Dr. Tiano Baudet.
Thanks, Collins. I think, yes, that's a good question. And the fact is the monitoring of all of these, both in terms of the number of cases, but also deaths and hospitalization, I mean, in all of the 47 countries that we are covering here, is really ongoing. And as I mentioned, I mean, previously, we have not really seen a kind of major upsurge in the number of cases, I mean, and also the number of hospitalization and admission in other countries, be they in Central Africa or in West Africa or also in East Africa at the time being. But definitely, as I was saying again, I mean, this dynamic of the pandemic, I mean, with the increasing number of cases, both in some of the Southern African countries, in Central Africa, notably here in DRC. So we might see, I mean, a kind of changing in the number of cases which has been admitted. But at the moment, really, we have not seen a major change at the moment, and we are getting ready, I mean, to provide the necessary support, both in terms of treatment capacities, but also in terms of surveillance to all of the different member state countries.
Thank you, Dr. Tiano. We still have a question from the New York Times, and this question goes to Dr. Moeti. And the question is, what is the WHO Africa's position on some African countries rolling out booster shots whilst others are still waiting for vaccination doses to be distributed? And what does this mean for the solidarity Africa has shown so far during this pandemic?
Yes, thank you. We've had several African countries announce that they are going to be providing booster shots to their populations. And then I think one of these is South Africa, which has essentially been the epicenter of the African pandemic. It's been by far the worst affected country by various waves in terms of mortality, etc. in Africa. You know, overall, our recommendation as WHO has been that we need to see vaccine supplies being available so that as many countries as possible can provide vaccination to their most vulnerable population, meaning those groups, elderly people, people with some of the conditions that make them vulnerable to severe illness, healthcare workers who are at the forefront of exposure. So that is our recommendation overall. And we are asking that particularly those countries that have managed to vaccinate 60-70% of their population are expanding now, considering vaccinating children below the age of 15 years, etc. You know, we all work together as a global community to make sure that we're progressing together. So I would send out the same message worldwide to say, let us work together to make sure that we minimize the impact in terms of deaths, the impact in terms of economic turned down in all countries by working collectively to make sure that countries that have not vaccinated their populations in the first instance get to do so. And then WHO has clear recommendations about boosters for people who are severely immune compromised. That is, people who then are most vulnerable to being severely ill and dying if their immunity starts to wane while the viruses are circulating. So that is what I would say in general, including to countries in the neighborhood. But, we see that some countries, particularly a country that's been very severely affected, has a high prevalence of HIV in its population. Which is a situation of a country like South Africa, which I know is promoting booster shots that might be justified.
Thank you, Dr. Moeti. The next question is from Abdullah Sani from the Nature magazine. And this question goes to Professor Flavia. If the question is, vaccine coverage is disproportionately low in Africa and new variants are spreading fast, causing illness and deaths across the continent. Will Africa consider exploring treatment options in 2022? I mean, he's saying that he knows that there are efforts by African scientists to repurpose drugs used for malaria and other diseases, but infrastructure and recruitment challenges is still stifling progress. Will Africa consider really exploring some treatment options for this crisis in the next year?
Yeah, I mean, that is such an important question. And as Dr. Moeti said, there are a number of initiatives by the African Union to support this kind of work. But as I've said, what we have at the moment, in fact, is the vaccine. And I think the entire world is really looking at treatment options as well on top of vaccines. Certainly, as I said, the support for African scientists who have started already in collaboration with other colleagues in terms of looking at treatment options has already begun. That work has already begun, but we certainly do need support. And I think it's such a critical question to ask. But I think in answering it, I want to say, one, it's really about the collaboration together with other countries. And certainly we don't have a lack of capacity of ensuring that we can develop treatment options for our population in our region. What we do lack, though, is the support, and I use support in the broad sense, whether it's financial support or support in terms of manufacturing or support in terms of the collaborative science as well. But certainly in terms of capacity, we don't have a lack of that, and it's something that I certainly would welcome in terms of treatment options. Because remember, even in all other diseases, not just COVID-19, we've never only just used one bullet in terms of managing disease. We will always use vaccines. There'll always also be treatment options. So I don't see that the COVID-19 should be any different. Thanks, Colin. Back to you.
Thank you, Dr. Flavia. The next question is from Falila Bagdamasi from France Info. And the question goes to Fiona. The question is, sometimes we hear that there are not enough vaccines. And what is the situation in terms of availability of doses on the continent? And the second question is, some say that even though vaccines are sent to Africa, people won't use them because of vaccine hesitancy. What's your response to that?
Okay. Thanks. Those are excellent questions. So starting with the first one, that sometimes we hear that there are not enough vaccines. This was the case earlier in the year when there was a shortage of global vaccine supply, and we all know what happened in India that really cut off the COVAX supply, and especially to Africa. So with donated doses and new manufacturing agreements and sites, the COVAX facility has managed to address these shortages. So in theory, all countries have access to adequate vaccine supply. If a country signals that they have capacity to absorb the vaccines, they have good prospects to receiving them. And around 20 million vaccines are shipped to the African continent per week now. And that was almost what we used to have in every, like a month or 3 monthly at the beginning of the year. And these are shipped through COVAX, the AVAT delivery system, and other bilateral deals and donations. And we've received around, almost 500, we're almost getting to 500 million doses. So on the next one, where the question was on the vaccines are coming, but they're saying that people may not take them due to hesitancy. We have seen recurring themes across the countries on barriers and bottlenecks to the COVID-19 vaccine rollout, with some unique issues. Several of these are systemic and impact healthcare delivery generally, and not just the COVID-19 vaccination. Yes, vaccine hesitancy is present in some countries, and we did go out to understand what is happening. Like Dr. Moeti mentioned, we have found that there is inadequate community engagement and inadequate response to addressing people's concerns around the safety and side effects of this vaccine. And these are issues that drive hesitancy. We've also seen in some countries where, like, religious leaders have a lot of following, and whatever they say is very important to their flock as opposed to what science has to say, to an extent that even the scientists within those religious denominations do not take up the scientific information, but prefer to follow what their religious leaders are doing. So engagement of such very important opinion leaders needs to come into play. And this is going to take place as soon as possible. It has even started in some countries where we know that inadequate vaccine uptake driven by hesitancy is ongoing. But with the third wave that we witnessed in most countries, but also the coming of the fourth wave, we know that when a wave comes, the hesitancy tends to go down. And this is what we have witnessed. Thank you.
Thank you, Fiona. I will invite Dr. Moeti to weigh in on some of the comments so far.
Yes, thanks very much. No, I just wanted to add something to the question around therapeutics and treatment. I think, African scientists, African clinicians, African countries have been interested in obtaining whatever therapeutics are available. And we have, of course, seen attempts to see if drugs such as ivermectin that are available in Africa and others might have an impact on the clinical picture of COVID-19, and the evidence has really not supported their utilization. We know, for example, that the drug that Merck has developed, molnupiravir, which has gone through some trials and has been going through emergency use listing discussions in various developed countries, has been shown to reduce severe illness. I think there are still questions with more data emerging as to how effective that is. But we're very encouraged by the attitude taken by that pharmaceutical company around technology transfer, waiving intellectual property that would make it more available. So I think the challenge really is, and then we know that while monoclonal antibodies are available, effective, the cost really is a challenge for most African countries. So I believe for us to have effective therapeutics available in Africa, there really, again, will be a need to work around those principles of working together in the context of a global pandemic that has caused so many deaths, including by the pharmaceutical companies, to enable these medicines to be affordable in low-income countries sooner than later, sooner certainly than we've seen in the past for medicines like antiretroviral therapy for HIV. That is something I think that continues to need to be pursued. And of course, I agree very much with Prof. Flavia that support for our scientists' engagement in clinical trials in African communities and African countries is also extremely important as this pandemic continues.
Thank you, Dr. Moeti. Now, we have a question from Joanne Stockhoff of The Guardian in Northern Ireland. Now, this question goes to Dr. Tieno Balde. The question is, what is WHO's assessment of the current health and food security situation in South Sudan following the devastating floods this year and the increasing hunger situation? And what provisions are being made for medical supplies and services?
Thank you. Thanks, Collins, for this. While definitely we are battling the COVID-19, also there are many other emergencies which are really occurring in the region, and on which also we are really trying to provide the necessary support. And the situation in South is one of them, and we have seen, these devastating situation since past October now. For the past 3 kind of increasing needs, humanitarian needs for the people who have been affected by the flooding. And from the WHO point of view, this event has been even graded, because it goes beyond the current existing capacities at the country level, so calling for more surge and more external capacities. So this has been done. The World Health Organization graded the event as a grade 2 event. That was almost now 1 month ago. So work is ongoing on the ground for assessing and also for responding to the situation. And definitely one of the main area of action is about the provision of care for the essential healthcare services. For all of these endemic prone diseases, such as the malaria, but also all of these diarrheal diseases or acute upper respiratory infections. So there have been many efforts which has been conducted for providing additional supplies, for recruiting more doctors, more nurses who can go into the communities for treating these patients affected by the floods. But one other very important element is obviously also the provision of the occurrence of new outbreaks, given the current situation, diarrheal diseases outbreak. This is something which is also very important, on which we are trying to detect and to monitor in order to respond to them as quick as possible. And obviously this is raising another point, the complexity of this type of situation, where we know also the COVID-19 is happening, is occurring, and while also we are handling with this other emergencies. So those are the type of elements that we are currently doing for addressing the situation in South Africa, and obviously working also with partners for addressing the nutrition component. This is also when the cases become kind of severe acute malnutrition, where how can we really support more on the provision of appropriate care for the affected people by the flooding in South Sudan. Thank you.
Thank you, Dr. Bode. The next question is from the Spanish media outlet EFA, and the journalist is Lucia. This question goes to Dr. Fiona Atuhebwe. And the question is, Dr. Mihigo said a new system is being set up to allow countries to communicate how many doses they can absorb before sending the vaccines through COVAX in order to ensure that there is no waste. What was the then allocation system until now? And then when will that new system be established? And then the second question is, how many doses do you plan to send to African countries to COVAX for next year?
Thanks again. That's a good question. So let me start with what were we doing? How was the allocation mechanism in the past? So if you remember right from the start of the COVAX delivering vaccines to the COVAX members, it was each country will get at least vaccine to cover 20% of their population by the end of 2021. So what the previous allocation mechanism was we used to go for countries to ensure that the equitable supply is ensured. If a country has received 10% vaccine to cover 10% of their populations, it would be deprioritized as opposed to the one that has received vaccine to cover only 2%. And we ensure that those that are behind the queue get more doses. However, that's how we ended up falling into what we've seen, with countries receiving doses that they are unable to take up. But also previously, when we had the short expiry, short shelf life doses, we knew countries that had very good uptake. So we would send this vaccine to those countries whose absorption rates were really high. So, and the more we had with the short expiry doses, that means that particular countries were receiving more doses than other countries. Then when we decided to follow this equity part, where everybody is pushed along the line to ensure that we get to 20% of their populations, there are countries that couldn't absorb these vaccine doses, and we still gave them the doses in the spirit of equity, and they couldn't use them. So now the COVAX facility has put in place a mechanism to, it is called, there's a platform, a COVAX platform, where countries get in there all the WHO emergency use listed vaccines, approved vaccines are, and the country will tell us what vaccine type is their highest priority, and then what would also be desirable. So with this, we also ask them, given their absorption capacity and the plans they have in place now, how many doses do they think they can consume in the next 1 month, in the next 2 months, taking into consideration people that are still waiting for their second doses and all that, their budgets and what they have in place. So we've given them a chance. This has already started. We've given them a chance to actually go ahead and give us this information. Right now, the allocation follows this. How many doses are we planning to ship next year as the COVAX facility? We are planning to give countries actually as many doses required to meet the global targets, because the funds that we have for the purchase of vaccine, but also the doses that have been donated to us, the COVAX facility, are able to meet these huge percentages. So the more we receive doses, the more we also have more funding. We also had funding that is secured for 2022. We hope to get more than enough doses to meet the global targets through COVAX. Thank you very much.
Thank you, Dr. Fiona. Just let you know that we will be wrapping up shortly. We just want to take some few questions and then we'll wrap up shortly. The next question is it goes to Dr. Nixie. And the question is from the Media Hack Collective. And the question is, when WHO Africa notes the emergence of variants such as Omicron in African countries, what definition does WHO use to indicate that a country has detected Omicron? Dr. Nixie, the floor is yours.
Thank you so much. Thank you so much, Collins. This is quite a very, very important question that we need to get a very clear statement to our journalists as well as to the people that are listening to this press conference. The WHO is using a strategy that once the virus or the samples has been detected, showing that it's got a proxy or a marker of a target failure in the spike protein, that virus needs to be prioritized for sequencing. So with that, we are trying to rule out any other information that they might, if they can use the PCR diagnostic method, stating that that is an Omicron, and then it turns out not to be an Omicron. The reason for that, previously the same marker was seen when they were doing some molecular testing for viruses, where the Alpha variant was also showing the same S gene target failure. So therefore, to use the PCR or the diagnostic PCR to say that a virus or that sample is an Omicron might even misleading. We have seen this similar situation taking place in many countries where they were using the diagnostic PCR. Apparently, there was a failure in their S gene, which is a part of the genome of the virus stuff that you're talking about here. And then they started reporting that they do have an Omicron. And then after that, it's only when they've said, no, this information is coming from our diagnostic settings. So therefore, we are advising almost every country that whatever they see a target failure during their PCR, during the diagnostic PCR study, they need to forward those viruses or those sequences or those samples to the sequencing department for a confirmation if that target failure is really caused by the presence of the Omicron in that particular sample. So currently, WHO is working with some researchers to look at the specific PCR screening assay that is going to be targeting certain mutations that are seen on the Omicron. And then that's the only PCR that once they've got the results out of them, then they've got all the permission that they can report that particular sample is actually positive for Omicron. But so far, all the results that has been reported, especially even in Africa as well as also internationally, they are based after the confirmation of the genomic sequencing. So therefore, the definition of WHO until further notice or until further guidance has been given to the countries, any sample that is having a target failure at the S gene area that sample needs to be referred to the sequencing department as soon as possible, and it shouldn't be reported as an Omicron. They can say they suspect an Omicron, or they sort of like a sample is showing some target failure, but it is not a confirmed Omicron results that the diagnostic PCR is revealing up until it's confirmed by genomic. So we still stand as WHO. Genomic is a gold standard, and it needs to be the one that is confirming all the Omicron cases that are coming from the countries. Over to you, Colin.
Thank you, Nixie. The next question is from Nicola from the Cape Times in South Africa. And the question goes to Dr. Flavia and Dr. Moeti. The question is, what do scientists predict the pandemic will look like in 2022 in terms of the way the virus behaves? And are we going to see some more waves? I will ask Dr. Moeti to respond, and then Dr. Flavia will also weigh in.
Yes, I think that the potential for waves to continue, the potential for the emergence of variants that might not only be more transmissible, that's driving out the cases, but also that might be more dangerous in terms of causing severe illness and death is certainly there in a virus that is changing so much, and where we continue to have transmission, particularly among unvaccinated populations on the African continent, with a kind of scenario that my colleagues have been describing as far as vaccine coverage is concerned. I guess globally, where the situation has been better in terms of vaccination in some regions, although not in all parts of the world, we hopefully will be getting then fewer cases going up. I mean, we're seeing now in Western countries, in Europe particularly, where the vaccination rates have been averaging at about 50% higher in some countries, lower in others, a wave again of the Delta variant that had already been present in this region. So I think we're expecting to continue to see ups and downs of waves emerging, hopefully less severe in terms of the height of the wave, in terms of deaths, as we are working globally to vaccinate the population worldwide in order to prevent this. But we are very concerned about the implications in our region where the vaccination rates are so low.
Thank you, Dr. Moeti. Dr. Flavia, could you kindly weigh in on this?
Yeah, no, I couldn't agree more with Dr. Moeti. I mean, the consideration of the number of subsequent waves that we will have really depends on a number of factors. I think one is certainly the virus itself and how the virus behaves, and the determination of the various factors that Dr. Moeti has put forward. I think the people themselves is another important consideration, and the behavior of people. There has been a global promotion of non-pharmaceutical interventions, but I think that if populations do not adhere, regardless of their status, again, I want to reiterate that being vaccinated does not mean that you are not going to contract COVID-19. And so I think that the issue of people behavior, as my colleagues, Dr. Fiona have been saying, and Dr. Balde have been saying, the issues around how populations behave is a very important consideration. And I think the other one, I kind of want to put it as the response, and it's whether it's a macro and a micro response. Macro meaning, what do the leaders do when they are faced with evidence that is there in terms of this is what the virus is doing? And so I think the leadership and leadership response is something that is particularly very important. And I think the support as well in terms of at a micro level of the number of community projects that we put in place, particularly as we say, supporting primary healthcare infrastructure in terms of dealing with with COVID-19 will be very important. So I think, as to just agree with Dr. Moeti, if these things are not in place, certainly I think in terms of prediction, because when you do the prediction in terms of modeling, you put in a number of indicators, and some of them are these ones that I've spoken about that will determine when we are going to have a next wave and how soon we're going to have the next wave. And sometimes the modelers can even go as far as to say how big that wave will be, depending on the various indicators that I've spoken about. Thanks, Collins, back to you.
Thank you, Dr. Flavia. And this is our last person, and the person goes to Dr. Moeti. They say that a country like Kenya has had an increase of 5-fold in case loads after being on the green for months. That is recording under 5% positivity rate. Yesterday, the country posted 6.5% after 3 days consecutive of reporting 5%. Should this be a cause for concern? It's from the NTV in Kenya.
Yes, thank you very much for that question. I think, of course, if we're starting to see an increase that precedes a period where we are predicting that there will be more movement of people, more gathering of people, and the risk of transmission will be higher, that is a cause for concern. So that is then a reason to intensify all aspects of the response that have already been mentioned by myself and my colleagues previously, immediately. So the communication with people, ensuring that they understand the role that they can play, and then strengthening whatever public health and other measures that are possible in order to minimize and start to affect what happens as an increase, and intensifying also the surveillance so we can see where this is occurring, try to understand why it is occurring, and sharpen the interventions to minimize the peak that it will reach. I think that's what one would suggest needs to be done, not only in Kenya, but in all countries.
Thank you so much, Dr. Moeti. We are coming to the end of the virtual press conference, and I'd like to turn to our panelists for their final word. So I'll go to Dr. Flavia for your final word. You have the floor.
Thank you very much, Collins, and thank you, colleagues. It's really just always such an honor to engage on platforms such as this. There is no doubt that in terms of support for the African countries, I really want to urge support for scientists and the work that is happening, and in the broad definition of support to again appeal in terms of adherence to non-pharmaceutical interventions. In the absence of in the absence of the broader vaccination and all the other things that are needed, it's important for us as a society and as a population to adhere to what we have, and what we have at the moment is non-pharmaceutical interventions. Again, to reiterate the issues around vaccine and vaccine access, the global solidarity is something that really, I think, has been reiterated in a number of platforms, and we can't stop reiterating it in terms of working together. There is no doubt that we will never get out of this until we work together. And from my side, really, in terms of the support of the work that's been done on the region is so critically important, supporting colleagues like Dr. Moeti and all the other colleagues who are supporting countries and who have done exceptional work under difficult circumstances is so important. And I think that taking care of, in a broader sense, of our health care workers who are exhausted, who have been battered, who have been bruised during this time, because they're not only dealing with COVID-19, but many other ailments that are there. I mean, you have countries that are like my own that have got a quadruple burden of disease, and we still have to deliver babies. We still have to immunize. And so the support for healthcare workers is something that's so important. But I think in terms of the silver lining, Collins, is to say, again, from our side as scientists, the gratitude, really, we cannot express it even more that has gone into this, again, the recognition of the evidence and the use of evidence that has come out from scientists in terms of policy and decision making is something that we certainly value and appreciate. Thank you so much. Back to you, Colin.
Thank you, Professor Flavia Senkbuge. I now invite Dr. Moeti to give her closing remarks. Dr. Moeti,
yes,
the floor is yours.
Thanks very much, Collins. I mean, just to start by reflecting that it's been an extraordinary year of ups and downs, of waves of the pandemic, of discoveries of new tools, of collaboration of an extraordinary nature, and of a huge amount of work by everybody who's been involved in this work, starting with Africa's political leaders around the African Union, with ministers of health, with other sectors, ministers, partners that have come on board, the private sector, very much so in many countries, and also very much the scientific community. I'll just echo what Prof. Flavia said in the important role that they've played. And finally, people, you know, the mothers, fathers, people in communities, the community leaders, community workers who have really provided tremendous support, leadership in responding to this very challenging situation. And I think we've seen positive outcomes, rewards, initiatives starting, new partnerships, new discoveries, innovation. So it's been very much a year of learning, trying, striving, achieving, of course, facing many challenges, but the biggest one of which has been around ensuring that we are all moving together as one world so as to vaccinate and protect people. So one of the final messages, so as not to be too long, is to urge all of us to do everything that we can to influence the situation, starting with individuals. Please, let's get vaccinated. Please, let's not spread false information against the vaccine. And those of us who've been privileged to be vaccinated, and I would count myself as one, let's spread the word that we were vaccinated. My arm was sore and aching for over a day. That's what happened to me when I received, because I happened to be traveling in South Africa, my second Pfizer dose. I was not ill at all. I had this discomfort, and I now feel more confident to start to, you know, be part of resuming normal life. I think we need to understand that the benefit from the vaccine at the personal level is that we will start to see together how to normalize some of the things that we've had to adjust so much to doing because of the risk of the COVID-19 pandemic. But finally, the virus is still circulating, a highly transmissible variant is spreading. So we need to do our part as well in protecting ourselves, protecting our families, masking, distancing, keeping that hygiene, not going to gatherings, making sure that when we have to be indoors together, we are in well-ventilated places. And then just to finally end by thanking very much our journalist colleagues. You've kept up your work of informing the communities, informing the population, carrying out messages to policy workers, healthcare workers. Thank you so much for the work that we do. You've taught us a lot as well. You've helped us to have access to information that we needed for our work in WHO. And I look forward to our continuing work with everyone next year to consolidate what we've done. In the end, perhaps the dream that we have is that this COVID-19 will become a little bit like influenza. It keeps changing. We need to keep tweaking the vaccines. It's under control and it's not causing the types of waves that we are seeing and the level of mortality, and most importantly, the impact on economies and on all aspects of life. And it becomes something that we can live with. That will require collective effort as the world. Thank you all very much and see you next year.
Thank you, Dr. Moeti. We have come to the end of the virtual press conference, and thanks everyone. Happy holidays and best wishes for the new year. Bye-bye.